love neonates. And Sian is our queen of neonates,
yes, of course.
Evelina.
Yes.
But it's such a lovely specialty to work in. And it's nice to get to know the parents because it's quite a vulnerable time for them and their child. But the input that we have from the pharmacy perspective is great. There's a lot of impact that we make in terms of administration, looking at the prescribing, the safety, putting in guidelines into place like formulary. How do you get tiny doses from standardized adult medications? There are a lot of challenges that you have to face, a lot of obstacles that you have to overcome.
And a lot of clinical dilemmas to do when there's absolutely no evidence at all. If you imagine about 90% of the medicines used in neonates are unlicensed, right? They don't have a license for children, even just like in neonates. What can you do when they're, like we always say about evidence-based practice, but in children, like it's really common to use unlicensed medicines. It's almost like an inequality of access to medicines for children themselves. When they are most at risk, the developmental growth changes every day, but you don't have the proper support for them to go through clinical trials to find the right doses, the side effects, whether it works for them or not. It's really different.
It's part of the beauty of being in this specialist area, though, isn't it? You've got the opportunity to work with people who want to do the research.
Yeah, and that's where I first feel I'm fully embedded in the MDT, is when I work in NICU, in natal ICU, because you are working alongside dietitians and the nurses and the registrars and consultants every single day, talking about the PN for the babies, where you can fit in, you can just squeeze one more calories in, then you'll be a winner for the day. And what happens if you have too low glucose, or the liver is not metabolizing the lipids, not handling lipids very well because they're so premature. And babies are 500 grams, 600 grams. And so what I can do for you, darling? I really love doing it clinical pharmacist in neonates or like in children, because this is where we actually fulfill the duty of a pharmacist to safeguard these children and generate evidence for them as well. And it's when this rotation actually, I co-write my first paper with a registrar there on neonatal PNs.
Oh, amazing.
It's literally like, okay, what can we do to support this cohort of people when we just don't quite know what to do with the PNs? And that's why starting my first taste in research is like, this is the best rotation ever.